Antibiotic resistance. The key facts for antibiotic resistance are antibiotic resistance is one of the biggest threat to global health or food security and development today. It affects anyone of any age in any country. Uh, Antibiotic resistance occurs naturally, but misuse of antibiotic in human and animals is accelerating the process. Now, a growing number of infections such as pneumonia, TB, gonorrhea, and salmonellosis are becoming harder to treat as the antibiotic use to treat them become less effective. Antibiotic resistance leads to longer hospital stay, higher medical cost, and increased mortality. Now, mostly antibiotic are medicines that used to prevent and treat bacterial infection. Antibiotic resistance occurs when bacteria change in response to the use of these medicines. Bacteria, not human or animals, become antibiotic resistant. These bacteria may infect human and animal, and the infections they cause are harder to treat than those caused by non-resistant bacteria. One more problem is antibiotic resistance that leads to higher medical cost, prolonged hospital stays, and increased mortality. Even if new medicines are developed without behavior change, antibiotic resistance will remain a major threat. Now, what is the how to prevent and control? To prevent and control the spread of antibiotic resistance, individual can use antibiotic when prescribed by a certified health professional. Never demand antibiotics if your health worker says you don't need them. And also always follow your health worker's advice when using antibiotic. Never share or use leftover antibiotics. Mostly we have to prevent infection by regularly washing hands, preparing food hygienically, avoiding close contact with sick people, practicing safer sex, and keep vaccination up to date. One more thing we have to do following the WHO 5 keys to safer food: keep clean, separate raw and cook thoroughly, keep food at safe temperature, use safe water and raw material. To like recent developments, like while there are some new antibiotics in development, none of them are expected to be effective against the most dangerous form of antibiotic resistant bacteria. WHO also plays a very major role to overcome that, to improve awareness and understanding of antimicrobial resistance, to reduce the incidence of infection, to strengthen the surveillance and research. So that's all about. One more thing I would like to say about antibiotic resistance: don't use antibiotic unnecessary until prescribed by health practitioner. So that's all about